She is not going to fit from here to here on one cassette. Nobody is. We even did Omaris and she didn't fit. So it's going to take 2 pictures to do 1 picture. So first I'm going to start at ASIS, so I know I have the top of the hip joint. I can show a little bit of collimation. Now to make this a true AP, we need a 15 to 20 degree medial rotation. Stick a right marker right there. Can I shield?
No.
I could do 1 gonad, not necessary. All right, hold your breath, beep. Now I need to get this part of her femur, but to make that an AP, it only takes 5 degrees. So we're going to take some of that off, and then I'm going to come down below. Realign all that. Okay, below the knee joint. Hold your breath, beep. So that's an AP of the entire femur, 15 to 20 for the top, 5 degrees for the bottom. Can I shield for this one?
Mm-hmm.
Mm-hmm. And lay a little strip on the top there. Be nice.
If we forget to move her leg to 5 degrees, is that an automatic fail?
No, patient position thing, because in real life it wouldn't matter. All right, lateral. So if you will now roll over into your right side. Okay, we need a 45 degree bend, too much. There's 45. Get that one gone. Come down a little bit. Probably be easier to bend that leg and put your foot, there you go. Well, now this is on top of there. You're going to show us your crouch anyway, so you might as well start. All right, so now we need a lateral. So I'm going to go past the knee joint, get as much leg as I can in this one. Beep. So that's a lateral of the lower. And now I need the upper, so I'm going to put top of the light field at ASIS. Get all that leg. Beep. It does look weird, but back in the old day, when it wasn't digital, we could do this. Now, doesn't that make more sense? Doesn't that look pretty? We can't do that anymore because you can't cock on a digital. So now it's just going to look kind of funny, but the radiologist knows that's what we do now. And you're going to have like a one with the bottom going this way, and then you're going to have one with the top going that way, kind of corner to corner on the picture. All right, that is a femur. You can lay on your back. Now we have a pelvis, 14 by 17 landscape. So the central ray is midway between ASIS and pubic symphysis. If I want to find her pubic symphysis, I'm going to roll her leg. I can feel it right there. There's ASIS. So in between, right there. And then the cheek was top of the light at crest. Look at that. Right there. So the last 2 patients I've had have been skinny minis, so that'll fit there, right? My right marker? That's not normally going to happen.
You have to put it on top of it.
So you're going to put it there on the patient.
Does it matter if you put it on the bottom or on the top?
Okay, so no and yes. No, if you don't get it in the thing you're looking, but in your head you just have to go, I'm getting a pelvis x-ray, right? It's a pelvis, it's a pelvis. If I put it up here, that's probably going to get in the pelvis. If I put it down here, it's probably going to be on the femur. So you just got to kind of think like, what I'm looking at is up, so I'm going to put it down. Now, if she's skinny and you put it here, that's not going to be a problem at all. But if most people are not going to have it, so you put it down. Oh, well, before I shoot it, what do I got to do? 15 to 20. I was telling the last group, that's an automatic fail. So be very careful with that. I was also telling the last group that I'm sitting right there in the chair. I can see when the patient's going, I can see what you're doing. You're like this, the patient's getting, okay, hold your breath, and then you start doing it.
Should it be more like this? Or like closer?
It's 15 to 20. It's not craziness.
Can we tape?
Okay. I've never had anyone ask that before.
Because I know I'm going to take forever and then...
Well, that's something in real life you do that at the last moment. You get 100% ready, and then the last thing on your way out, you do that because people can't hold that. It hurts.
Yeah,
You start
kinda
shaking.
Yeah, so, yeah, okay.
All right, what's next?
Hip, AP hip.
Hip? Okay, relax. All right, so our hips are going to be unilateral. You might have them bilateral out there, but we're just going to do unilateral. 10, 12, yep. All right, central ray is mid-femoral neck. So I'm going to start at ASIS. I'm going to go 1 to 2 medial, 3 to 4 inferior. That's my central ray. but it's an AP hip, so this leg has to come in 15 to 20. I got room up there. If I didn't have room, now I'm doing a hip, right? So I don't want to put it in the hip, I can put it up here. I was asking the last group because this looks weird to some people. Does that marker, is that the correct marker?
Yes, because you're on that right.
Because we're doing, a lot of people go, well, wait a minute, the light's passing into her left, so aren't you telling the doctor that that's her right over there? No, this is a right hip, so it has to be a right marker anywhere on there. So this is an AP hip, hold your breath, beep. Now we need a lateral hip, the central ray is in the exact same place, mid-femoral neck. So we're gonna do a bend and then a 45-degree abduction for a frog. That's a lateral hip. This is called a lateral hip, it's called a frog leg, it's called a modified cleaves. 3 names for that one picture. Hold your breath, beep.
Sorry. Bilateral frog leg.
Oh, okay. This one's gonna be, if somebody orders a right and a left hip, you're not gonna do the AP, the lateral, because that's 4 pictures. So you can get both laterals like this. I'm gonna do a double frog, and it's a 14 by 17 landscape, and the central ray is 3 inches below ACES. So here's ACES. So 1, 2, 3. She's got room over here. Hold your breath. Beep. So this is a lateral of both hips. Posterior obliques.
Axial outlet
Like
and then
AP
axial inlet.
It's an AP projection, but it puts the hip in a lateral position. All right, straight legs. So now we need an outlet where the baby comes out. And since we're only looking at pubes and ischia, we can fit that on a 10 by 12. She is a woman, so how much?
20 to 35?
That's a man.
Oh.
Women need more.
30
30 to 45. So just keep both people on 30 and you're safe. And if I ask you the question you don't know, that's 5 points, but putting it on 30 for both works. All right, central ray is 1 to 2 inches below ACES. So there's that. Down the middle, 1 to 2 inches below ACES. Hold your breath, beep. Now we need an outlet, and that's the same for everybody, for men and women. And it is a big light field. So it's a 14 by 17 portrait. And then see how it's 14 by 17, but when I angle 40 degrees, look how big my light gets. It's ginormous. And the central ray is right on ACES.
The other one is
1 to 2 inches below pubis. This one is on ACES. And with her, I can collimate because she's tiny. Look at the light. It's all the way like boob to knee. But we know the light's not that big. It's just the angle's distorting it, making it look that way. Where would I put this? That's a good one. I'm gonna have to look and be like, okay, the cassette's right there, so I can stick it there. Hold your breath, beat. This is a inlet. This is where the baby lives in, and that's where the baby comes out. And remember, we go out the inlet and in the outlet.
No rotation, like.
No, we don't care about our legs on these certain ones.
No, the posterior.
Posterior oblique. These are the Jude method. So 12 by 10. I'm just looking at acetabulum, just need a little light. All right, let's say we want to see her right posterior brim. What position should we put her in? That's true. I want to see her right posterior. If you want to get it in someone's posterior, what do you got to do? Put it up. So we're going to put her posterior up, lay back. Oh, you just did the little hip scoop. Ma'am, we're going to start this again, okay? You're going to lay flat on your back. We're going to bend this leg and just roll. Don't scoop. Okay, lay back. Old people do that all the time. They go and they throw their hip out. Now it's all out of whack and you got to start over.
Right, I get it.
All right, so we said we wanted to see her right. So it is up. So this one doesn't take a lot of movement. I'm going to start at ACES and just go 2 inches below. That's a right posterior brim. But this position can also show something else. What else can it show?
Your other side, but the,
Anterior brim. So she's in the same position, but I'm going to start at ACES. And since we're on the down side, we're going to get down. So I'm going to go 2 down and 2 in. And I would have to use a left marker over there because that's her left side. Does that make any sense? So you're going to pull out of the thing. It's going to say, if you're doing this, it's going to say left anterior brim for acetabulum. You're going to do this one. Christina?
Axiolateral hip.
Oh, last one. Okay, flat down on your back. So what do we want to do if we're doing someone's hip x-ray? Don't we want to do AP, beep, and then we want to do lateral, beep. So she's here and I did AP, and then when I went to do this, she's, ah! Okay, we'll leave that there. So then we're going to do a funny one.
So
Standing
table
straight.
all the way.
As far as you can get it because you know you're going to be working over there. All right, now you have to use a 10 by 12 for this. We do not have a 10 by 12 grid cap. So if you pull this one, you have to put this in here and look at me and go, grid cap, grid cap. So I know you know there's a grid cap. The femoral neck sits at an angle right here. It doesn't sit straight up and down. It's not sideways like that. It's at an angle. So I have to take the cassette and put it at an angle. I have to make the IR parallel to the femoral neck. All right, and then I'm coming around that way. Ugh. I now have to get my CR perpendicular to the IR. So I'm going to angle. And I'm going to take this leg that does not hurt you and hike it up there. Now you can see that my CR, I can't quite get it low enough. Ow! That's a crotch stretcher. I can't quite get it low enough, so what has to happen, I'm going to unlock this, which we have not yet used, and then I'm going to take this, and now I can shove it in, and loosen a little bit, shove it in. This has no tube angle, just so that I can get this handle below the tabletop. Yeah.
what did you just do?
What did you just do? All right, so now let me find her femoral neck. It's going to be 1 to 2, 3 to 4, and I'm right on it there. So I'm going to shove this up so that that's in the center. So now I'm getting her femoral neck. It's the tube thing. Everyone's freaking out. I know. Let me get this set, and then I'll show you. All right, so that is a axiolateral inferior superior, or the Danny Miller. This is because this leg doesn't hurt, but that leg hurts. So this is a lateral of the right hip.
And this leg is in turn it.
Yep, leg rotation. Because if she was able to do the AP and turn it in, she can turn it in for the lateral. She
It's
just
15
can't
to
do that
20.
frog. She just can't do the frog.
So what did you do with that?
Okay, so over here, okay, so we got this. Good. Let me just move this so I can show you the equipment stuff. We have not learned this thing right here. What this does is if I lock this, I can't move this way. But if I unlock it, see that swivel that I'm doing there? There's numbers right here. And if I have it on 0 and lock it, this is what we're all used to working on. With that at 0 and locked. If you undo this, now I can take this and I can move it out that way. See the movement that's happening? And here and there. So that's necessary to get the handle below the table. Just take a little practice. And now that I have it on 0, I'm going to lock it because we don't want that to move again.
In real life, you